Hello and welcome. Today we'll be discussing a relatively rare congenital anomaly of the urinary system, bladder septation. We'll explore what it is, what causes it, how it's diagnosed and treated, and more. Join us as we delve into the intricacies of this condition. The exact etiology of bladder septation is not fully understood, but it is primarily considered a congenital condition, meaning it's present at birth. It's believed to arise from errors during the embryological development of the bladder. During fetal development, the bladder forms from the urogenital sinus. In cases of bladder septation, this process is disrupted, leading to the formation of a septum, or wall, within the bladder. While genetic factors may play a role, specific genes associated with bladder septation haven't been definitively identified. Environmental factors during pregnancy might also contribute, but further research is needed to establish a clear link. The pathophysiology of bladder septation revolves around the presence of a septum within the bladder lumen. This septum can vary in size and thickness, ranging from a thin membrane to a substantial, almost complete division of the bladder into two compartments. The septum obstructs normal bladder function. It impairs the bladder's ability to fully empty during urination. This leads to increased residual urine volume. That elevated residual urine increases the risk of urinary tract infections, depending on the septum's location and size. It can also cause backflow of urine into the ureters, a condition known as vesicoureteral reflux, potentially damaging the kidneys over time. The abnormal bladder anatomy may also contribute to bladder dysfunction such as increased pressure, changes in sensitivity, or altered control. Bladder septation is a rare condition. Due to its rarity, precise epidemiological data are limited. It's estimated that it occurs in a small fraction of the population, though the exact prevalence is difficult to determine due to underdiagnosis and variations in severity. It affects males and females equally and has been observed in various ethnic groups. The diagnosis is usually done during childhood, but mild cases could go unnoticed until adulthood if they don't cause noticeable symptoms. Further epidemiological research is necessary to fully understand the incidence and distribution of this condition. The signs and symptoms of bladder septation can vary widely depending on the size and location of the septum. Some individuals may be asymptomatic, especially if the septum is small and doesn't significantly obstruct urine flow. However, common symptoms include frequent urinary tract infections, difficulty urinating, dysuria, urinary urgency and frequency, bedwetting and nocturnal enuresis, and abdominal pain. In severe cases, vesicoureteral reflux can lead to kidney infections, pyelonephritis, and potentially kidney damage. In children, symptoms may present as unexplained irritability or failure to thrive. Therefore, symptoms can overlap with other urinary conditions, requiring careful evaluation for accurate diagnosis. Diagnosing bladder septation involves a combination of clinical evaluation and imaging studies. Initially, a thorough medical history and physical examination are performed. Urinalysis is often conducted to rule out infection. The primary diagnostic tool is imaging. Ultrasound is a non-invasive method to visualize the bladder and detect abnormalities. Voiding cystoarthrogram VCU is an X-ray that shows the bladder filling and emptying, revealing any reflux or obstruction. Cystoscopy involves inserting a thin, flexible tube with a camera into the bladder to directly visualize the septum. MRI and CT scans can provide more detailed images of the bladder and surrounding structures, aiding in surgical planning. The choice of imaging modality depends on the patient's age, clinical presentation, and the suspected severity of the condition. While there aren't strict classifications or types of bladder septation in the traditional sense, the condition can be categorized based on the extent and location of the septum. The septum can be complete, dividing the bladder into two separate chambers, or incomplete, forming a partial partition. It can also be described by its shape, such as band-like or crescent-shaped. The location can also be classified as longitudinal, transverse, or oblique. Also, the associated problems in other parts of the urinary tract, such as vesicoureteral reflux, might also be considered when classifying a case of bladder septation. The specific characteristics of the septum influence the symptoms and treatment approach. The treatment for bladder septation depends on the severity of symptoms and the degree of obstruction caused by the septum. If the condition is asymptomatic and doesn't cause significant urinary problems, observation may be sufficient. However, if symptoms are present, surgical intervention is typically necessary. The primary surgical approach is resection of the septum, which can be performed through open surgery laparoscopically or cystoscopically. Cystoscopic resection is a minimally invasive option where the septum is cut or removed using instruments inserted through the urethra. Open or laparoscopic surgery may be required for complex cases or when other associated anomalies need to be addressed. Antibiotics are often prescribed to treat or prevent urinary tract infections. In cases of vesicoreteral reflux, additional surgical procedures may be needed to correct the reflux and protect the kidneys. As a congenital condition, bladder septation is not preventable in the traditional sense. There are no specific measures that can be taken during pregnancy to guarantee its prevention. However, maintaining a healthy pregnancy through prenatal care, avoiding exposure to toxins and teratogens, and ensuring adequate nutrition may help reduce the risk of congenital anomalies in general. Genetic counseling may be beneficial for families with a history of bladder or urinary tract abnormalities, although the genetic basis of bladder septation is not yet fully understood. The prognosis for individuals with bladder septation is generally good, especially with early diagnosis and appropriate treatment. Surgical resection of the septum can effectively relieve obstruction and improve bladder function. However, long-term follow-up is necessary to monitor for recurrence of symptoms, urinary tract infections, or the development of vesicoreteral reflux. Recent research focuses on improving minimally invasive surgical techniques for septum resection and understanding the genetic factors that contribute to bladder development and malformations. Advancements in prenatal imaging may also lead to earlier detection of bladder septation, allowing for timely intervention and improved outcomes. Future research aims to develop targeted therapies to correct or prevent congenital urinary tract anomalies.